So somebody gets the first, they bypass the first mistake, they bypass the second hurdle, and they get that right, and they're now in original Medicare, right? They've successfully enrolled in, as I said, the starting line or the bare minimum. And then from there, they want to go ahead and optimize coverage. They want to get something that fits for their needs. And then they potentially have a conversation with somebody with the phone that calls them, or they see a commercial that sounds very flashy and all these benefits and zero premium, and I don't want to pay anything more than I already have to pay. And so they get, if you will, duped into just enrolling in something without really understanding all of their options and all the ramifications of that decision. And let's say this person's having some health challenges, right? They're having some health challenges, and the person on the phone just says, great coverage, is amazing, you've got this, you got that, and they start really focusing on all the flashy things without really getting granular on the coverage. And even though the person says it's great, they don't really tell them why. They don't explain everything. So the person enrolls in Medicare Advantage as their initial product, their initial choice. And unfortunately, that person wasn't told that they have an open enrollment period to get a Medicare Supplement policy, right? And that's a 6-month, which really a 12-month, 6 months prior and then 6 months after the 65th birth month. They can get a Medigap, Medicare Supplement, same thing, with no health questions. This is super important for people that are dealing with challenges health-wise, or feel they may be dealing with challenges in the coming future. Maybe the person who really has stayed away from the doctor prior to Medicare because they didn't have very good health coverage. Maybe it was they couldn't afford it. Maybe they didn't have anything, and now they decide they're going to start going to the doctor. Well, you don't know what they're going to uncover, right? Maybe you've got health issues that run in the family. Maybe you have things in the family line that tend to pop up around this age range, but you go with Medicare Advantage first. Well, unfortunately, after that open enrollment period to get a Medicare Supplement, that 12-month window we talked about, that person is not going to have that ability to get coverage without any health questions. They're going to have to go through medical underwriting after that period of time. So they start with Medicare Advantage. They use it, health changes. They start using it a lot. They start getting a lot of bills, a lot of issues. Maybe they can't see the doctors they want to go see because of the network limitations. And they say, you know what, this is not working. I need better overall coverage. And I'm willing to pay for it now because my health is what's important, not my money. But unfortunately, that person now is in a predicament. They're in an issue. They're having an issue. It's because once you go Medicare Advantage initially, after a period of time, you can't always go back unless you can qualify medically.
Got it. So it sounds like that could actually create not just the potential issue of not being able to achieve that coverage, but it could create a very negative image for Medicare Advantage. I mean, sounds like that happens quite a bit where people get enrolled without truly understanding their situation and how that coverage will actually work for them, and leads to some surprises down the road. So I could see that for sure being a...
I agree. I think that's one of the big issues out there is the way some of the products are marketed, and it really goes on both sides, Medicare Supplements as well, but the way it's marketed by inexperienced people that maybe are well-intending, but they just lack experience, they lack proper training, and so they're out just kind of reading a script and telling everybody you should get this thing, and people themselves maybe don't have all the information. They didn't know what questions to even ask, so they don't know all their options, all the paths they can go down, and so they make a decision based on what they feel is best at that point, just without knowing everything, right? And that does result in a lot of issues, and then now the finger's being pointed at that product, when that product wasn't necessarily bad.
Right.
It was a bad fit for that person. And so it's a lot of a square peg in a round hole, or type of a situation that occurs many times out there because most people lack a consultative approach to Medicare planning. And we feel that it should be, I feel, and I know you feel the same way, that it should be handled very similarly as the financial, advisory space is handled, with care, with duty. And I think that results in most people on the other end, once they've gone through an experience like that, in being satisfied. That's where people end up having the good experience that they want when they go through a process like that.
And the confidence and peace of mind, knowing that as their health changes and evolves in the future, they've got good coverage in place behind them, in confidence in that decision that they made.